The views expressed in this webinar today do not necessarily represent the views, policies, and positions of SAMHSA, the Substance Abuse Mental Health Services Administration, who is, by the way, our funder. So this is the PTTC network in its entirety. The purpose of the Prevention Technology Transfer Center network is to improve implementation and delivery of effective substance abuse prevention interventions and to provide training and technical assistance services to the substance abuse prevention field. We are a free resource. If you are not located in one of our 8 states that we serve here, as you see highlighted in blue, I can guarantee that if you are in the United States, you do have a PTTC network available to you, and you can find that at pttcnetwork.org. We also have 2 national focus area centers, and there is a network coordinating center. So let's move on. So following today's webinar, there will be an evaluation, and our funder and we greatly appreciate your feedback on that. It lets us know how we're doing and if we're meeting your needs and if you found the information useful. So when you close out of this webinar today, you will automatically be sent to the, it's called the GIPRA. I don't know what it stands for, but it's our evaluation. You might get a little warning like, danger, danger, you're going to an external site. It's okay. It's just taking you out of this platform to the evaluation. Once you complete the evaluation, you'll get a link to this certificate of attendance, and here's the little QR code. I'll have that at the end so you can take a picture or put your camera over it on your cell phone if you'd like. But once you complete the evaluation, you'll see this. Oh, your survey is complete. Now you're going to be redirected in 5 seconds to another external link to get your certificate, or you can select this link to continue, and you'll go out to where the certificate is. It is a PDF that you have to customize yourself with your name and save it to your desktop. So I know I get a couple emails from people saying, I didn't get my certificate, and I know that it's really important to you, so make sure that you follow this. And if you have any problems, I'm here to help you. So that is our housekeeping and our introduction. With that, I'm going to hand it over to, as we have been calling it, our trio of presenters. And Carlton, I am going to give you the power to be the presenter, and you can begin with your introductions. Take it away.
Terrific. Thanks, Kristen. I appreciate that. Thank you so much. Listen, I am excited about today and excited about this training that we're about to get into. Welcome, everyone. And I see a good many of you have already started to populate the chat with some of your information, introducing yourselves. That's clearly what it is that we hope that you would do. We're going to be engaging with you throughout this 90-minute training through the chat and other functions of this. And so my name is Carlton Hall. I am the President and CEO of CHC, Carlton Hall Consulting. Our team was really responsible for helping to organize the development of this training series and the delivery of it. We also provide significant support to the Southeast Prevention Technology Transfer Center and their training and technical assistance delivery efforts. It is our honor to be able to have and bring together a team, which I'm so grateful to be able to work with the 2 gentlemen that have been friends of mine for longer than any of us want to admit. Collectively, we have more than 75 years of experience working in this field. Tracy Johnson is the founding managing partner of the TTJ Group, an extraordinary consulting organization providing training and technical assistance services to the prevention field across this nation. He's provided, and his team has provided training to SAMHSA's Minority HIV and AIDS initiative for many, many years. He was the project director for the Central CAP, the Center for the Application of Prevention Technologies. I'm extraordinarily grateful for Tracy's partnership and link up with CHC. Thank you so much. Dave Shavel, a dear friend of mine we've been working together. Man, we have more adventures that we care to share over this webinar. But a community organizer, a coalition director, trainer, master trainer, technical assistance provider, oversaw a state prevention. The state prevention services, I believe, over the state of Wyoming, if I'm not mistaken, and just an extraordinary, extensive amount of experience that we're hoping to bring together on behalf of serving you all who are going to go through this training with us today. I'm grateful to the Southeast Prevention Technology Transfer Center, Doctors Wagner and Wolfson and Kristen Kidd for providing the support that's necessary for us to be able to go through this training. So thank you all so very, very much. You all have already started. As you understand, this is, as Kristen mentioned, the third in this series of training. This is focusing on community organization for the prevention professional, right? And the way we're going to get into some formal definitions of that, but the way I want you to think about it, I love football. I'm a huge football fan. Actually, that's not true. I'm actually a fan of my team only. I'm only a huge fan of my football team. Unfortunately, my team did not present the skills that were necessary, the tools that were necessary in order to be successful this year. And the whole notion is that you cannot be successful by yourself. While I love my team, I absolutely hate Dave's team, but somehow his team was able to get through to what is called the postseason or the playoff season. So there are obviously some skills and tools that his team had and exhibited this year that my team did not. And in a very loose way, that's what this community organization training really is all about. It really is about helping you as the prevention professional understand what are the tools, skills, the components, the techniques, and the tactics that are really important for your community to work together collectively in order to produce the results that you all are trying to achieve. And that's where we're going. We crafted this training series to have kind of these three foundational training focus areas, right? We focused first on prevention fundamentals, and then we took you all through an opportunity to understand much more deeply some really key components, assessment, planning, evaluation, and how that is all relevant to operationalizing your efforts. And this third one around community organization is really about how you build the capacity around yourself as an individual to be able to produce some real important results on behalf of your community. We're going to come back next week and take everyone through who was able to get on. This is going to be a much smaller grouping. I believe we may have a few more spots left that we've opened up. That's this virtual masterclass. And in the virtual masterclass, what it is that we hope to be able to do is to provide everybody with an opportunity to really bear down on what we've learned over the course of this series and how do we actually apply that to our work. And so we're really looking forward to some important conversations and discussions that we're going to have with you all. I'm looking forward to seeing you all there. If you haven't signed up, I think Kristen is trying to give you the warning that you have a little bit of an opportunity to get in on that. And so as I mentioned, we are going to take you through this training today, but this is really intended for us to work with each other through these 90 minutes. And so please utilize the chat. If you don't mind, go ahead and put your name, your organization, the community you represent in the chat. Please offer a good idea of a community change effort that you're really proud of, or maybe it might be some important learning that you had over the course of the last few trainings that would be really helpful for us to hear. We will be providing this and discussing with you throughout the day. Kristen and the team from the Southeast PTTC, as well as Dave and Tracy and I, will be communicating with you and corresponding with you through the chat throughout this training. As I shared with you, we're about to get into community organization. We're really going to talk through some of those key steps for how to apply community organization tools and skills when you're utilizing the strategic prevention framework. How do we think about building engagement from our community to enhance our community organization's capacity and mobilize in order to be able to affect certain processes that was intended to produce meaningful change in your community? But before we get into that, I don't know if you've been anything like I have been during this pandemic. I've done a lot of streaming on television, watching shows, some of them junk shows. I've watched entirely too much television during this pandemic. And during this time, one of the things that I found out is that when you look at these series and you go from one season of that series to the next season of that series, before you get started with that first episode, before you actually get into the new content, they do a quick recap, a review. And that's what I want to do for you all now, is provide us with a quick recap of the last two trainings very quickly, because as we do with those streaming series, they don't go into great details. They just show you highlights. And so what I want to do is share with you some of the highlights from both Training 1 and Training 2. In Training 1, where we talked about the fundamentals, what we really focused on is we focused on those key ideas and concepts that we believe all prevention professionals really should understand and has as a part of their tool belt, on their tool belt, if you will. And so we talked about the public health model and how the public health model really is focused on understanding the relationship between the agent, the host, and the environment, and how as prevention professionals, we actually really do focus on all three of those components in order to understand the magnitude of the issues and the challenges of substance misuse within our communities. We talked about the importance of risk factors and protective factors and understanding the relationship between the two of them, and knowing that we actually have to address both in our work and in our efforts. We then spoke a lot about how both of those play a role in helping us to understand the relationship of prevention in the context of the behavioral health continuum. And the behavioral health continuum really shows that the relationship is something that we have to understand all aspects of that behavioral health continuum, even as we focus on delivery of universal, selective, and indicated prevention programs, and the importance of understanding the distinction between both individualized strategies as well as more environmental or shared community strategies, that we can't have either or, we actually need both. That's what it is that we're focused on. And what helps us to organize all of that work is a framework that we refer to as the Strategic Prevention Framework. That's the importance of understanding all the context that we are talking about here. And so we did that in Training 1. And in Training 2, we talked about, now that you had those tools on your tool belt, how do you actually operationalize that? And that we focused on three critical processes and products that every prevention professional needs to understand. A community assessment, which really helps you to create a picture of your understanding, right, by focusing on the priority needs, what's going on with respect to your resources. You're looking at your readiness, and how do you utilize that to analyze what's really going on within your community, and then how you translate that into a logic model. And that logic model is merely a representation, a visual representation of your understanding of the problem and how you intend to address that problem. So it's really breaking that issue down in a way that your community can really begin to be strategic about addressing it, which is why it is a prerequisite before you start planning in your work and looking at how you might bring on board evidence-based programs and practices, looking at comprehensively addressing your issues and your challenges so that you might be able to put forward a plan of action that you will evaluate over time. All of that is then guided by that strategic prevention framework and the concepts and the tools of the SPF. And so that's a quick recap before we get into this next episode that we're about to jump into. And Dave, remind me who's next. Are you up or is Tracy up? Tracy, are you up? All right, then, my friend Kristen, if you wouldn't mind, I'm going to go ahead. I'm going to do a quick poll real fast. Real fast. Folks, what I want you to do is I want you, now that we've talked about this, I want you to share with us what is the role of the coalition and the prevention providers. What do you consider is the role that you all play? A, implement the SPF in their communities. B, provide information and education to youth and adults about making healthy decisions. C, address risk and protective factors. D, implement strategies that address the individual and community environments. E, building community resources along the continuum of care. Or F, others, and you can put it in the chat box if you like. Man, we're going to have to shorten these polls because that was a lot of reading. Go ahead and put the poll up, Kristen, if you wouldn't mind. Let's give these folks a chance to answer that before I transfer everything to Tracy. Do we have a poll that's up?
There on the side where the chat, unfortunately, the WebEx.
Oh, that's right. That's right. Kristen, thank you so much for reminding us of all of that. Folks, everybody, you will find the poll on the side where you see the chat, so you might have to open it up and expand it for yourself. Forgive me for that. And Kristen, go ahead and close that poll out. Let's see where we are with that and see what results we have. A lot of folks are putting things in the chat. Most of you are putting all of the above because you didn't go for the bait. I understand it. You're saying it's too early for all this, Carlton. Let's go and get into the meat, and we're going to go ahead and transfer this. And I'm bringing up my great friend Tracy Johnson. Tracy, go ahead and take it away, my friend.
Hey, thanks a lot, Carlton. And as always, it's awesome to be here and with you and Dave as the dynamic duo. I'm proud to be a part of the team. And so, hello, everyone. Good morning. And it's awesome that we're going to talk about community organization. And that's what we're here about. I'm going to be able to provide some of my experience on what I know community organization is really about. We know that it comes in all forms. And when we talk about substance misuse prevention, any other kind of prevention, or any other kind of work in our communities, I'm from Illinois originally, from a small community in Northwest Illinois. I now reside a little bit in Texas, but I know in those works that I did in my nonprofit was about community organization and how important it is. So we're going to discuss a little bit about what that looks like. We know that community organization, I want you all to really pay close attention to this definition. And I ask for you, as you look at it, you notice the words that we've kind of underlined in there is that, the key words of community organization. Clearly, it's a process by which community identifies a need and our objective, and then ultimately takes action. But the key thing about this is that by taking action, this process really gets folks to be cooperative and collaborative together collectively, both in attitudinal ways as well as in practical ways. And then ultimately, we begin to see a lot of change take place. But I think when we talk about community organization, you ask the question, why do we do it? Who does it? And how do they do it? How do they get it done? And what it's really about? What is it done for? Can you all hear me, Carlton? I heard someone say they had problems with hearing. I seen that came up, so I just wanted to make sure you all hear me well.
You sound good.
Okay, awesome. Thank you all very much. So it's really about the who, the what, the why, the who, the how, and the what we're going to talk about. And clearly, when you look about community organization, the word that really stands out you see there is power, right? And so it plays a critical role in what we do and how we do it in our work in prevention as well. So what is community organization? Boy, you guys ask awesome questions. What is community organization? Community organization is examples like what we've seen with students against destructive decision making, and that's they do youth-led stuff, to prevent underage drinking behavior. Also, you may see a community organization example when a parent resource organization or a health service organization really looks at to increase parent involvement for the health and the well-being of their young folks. We also see it in many targeted campaigns. I don't know, the tobacco prevention group around the country has really shown us by using targeted campaigns to pass ordinances that plays a critical role. And it took community organizing to really make it effective, both at the community, particularly at the national level, but also at the local level. And that's where community organizing takes place. It has different levels. And, of course, through our drug-free communities, if some of you are familiar with those, through our drug-free communities, we see the essence of a good drug-free community organization, a coalition, is really based itself around doing good community-wide behavioral health planning and activities, but ultimately in the center of that is true community organizing, and that's what's important and how that works out. So, again, you all say, what is community organizing? Well, it's in your community. So think of this in the chat box. I want you to give me some examples. I want my team to sort of help me see what folks are saying. But in the chat box, tell me what examples of community organization do you see in your community, or have you seen? Give me some examples, you all, because there are several examples of community organization that's there. Feel free to bring that up. Also, when you talk about that community organization, give me some ideas of who's involved. Just give me by their position. Is it the teacher? Is it the student? Is it the community activist? Is it a grassroots person? Talk about who's involved in that. What are you guys seeing?
Tracy, I think I know you live in Georgia. Right now, we see in Georgia getting the vote out. There's an important vote in Georgia today. That's a level of community organizing, getting people to go out and vote.
Yes. And then, okay, that's a wonderful example. Thanks, Dave, for offering that. So when we talk about community organizing, we see it, and you guys have seen it. You guys are throwing up some great ideas. I'm seeing it on the chat. Awesome. Thank you for providing that, because that really provides a really sense of what's going on and what's happening in your community as you see it. But I also want you to ask the question, what issues are being addressed? Just give me some examples of what issues are being addressed, and then tell me, after what are those issues being addressed, are they effective? Are the community organization process, are they effective? Are the issues effective? Some are saying drug and alcohol abuse. Awesome. Keep them coming, you all, because when we talk about community organization, we have to ask ourselves these questions. What are some examples that you've seen? Because you don't have to recreate the wheel. Who's involved in some of them? What are some of the issues being addressed, and why it's important that they are involved? That's really critical.
Tracy, we're seeing some extraordinary examples that they're all providing in the chat. Social justice issues as being efforts that are going on, students against drunk driving, everything to local organizations that are addressing public health issues. So just an extraordinary range, and what I really love about that are people are applying these community organization concepts to a wide variety of issues, not just substance misuse prevention, which is really the key here. It's really the key to understanding what it is that we're trying to present. Excellent.
And many times, a lot of times I've found and seen examples around the country where substance abuse prevention has joined other community organizing opportunities, because it all has a vast array of being involved. So thank you all. I see something around opiate overdoses in college settings. That's a strong piece. County coalitions and so on, and also mutual aid networks to address homelessness and housing. I think COVID has really brought on, and that's the big elephant in the room we don't want to ignore. But it's brought on the ability for even more community organizing in so many different facets. So I really love and enjoy what you all are providing as examples, and we can go on and on with that. So let's look at the key skills buildings for community organization. One of the things we want to talk about over these next series today is we really want to focus on these key skills. They are volunteer member management, group facilitation, cultivating the leadership, and then developing strategic alliances and collaborative agreements, okay? So when we talk about volunteer management, we're talking about really getting those volunteers out there, getting them involved, then managing them, and then encouraging them. Those are the things I think about, because successful community organization really requires the involvement of community volunteers and community partners. It cannot happen on an island by itself, you all. And if we're going to do it, we need the bodies, we need the people at all levels in all areas to really, really be effective at this. And volunteer management is really critical. What do we mean by volunteer management? Well, we see, the American Society for Association Executives has a really nice, simple tool for you to look at and to utilize. And so when we talk about community organizing and the volunteer management component of it, it's about recruitment. We'll talk a little bit more about that. It's about retaining. So not only do we get folks to come to be a part of this strategy or this initiative, but we have to also keep a focus on retaining them. And then we look at reviewing how well we've done in keeping them and having them involved in the process. How is that going? Sometimes we get so caught up in the emotional piece of the community, organizing process, we still have to manage it and manage those volunteers, and reviewing that is critical. And then also when we look at, recognizing, that's really important, because you have to recognize and your volunteers for their participation. You have to show that you really appreciate them for being a part of this. And then, of course, in a cyclical process, we want to reward the folks who have put their time and effort. And I like, in my community organizing strategies, of rewarding everyone, from those who just gave the smallest piece to it to those who really gotten involved in a more broader aspect, so that everybody walks away with a strong, important part of being credible and involved. Feel free to also show that, in your chat, how many folks have you used some of these volunteer management skills in your community organizing process in your own community.
Tracy, there's a comment in the chat box just talking about that. It's from Jennifer saying recognition is crucial. I've seen so many organizations flounder because they don't cultivate and recognize their volunteers. Correct. Again, that's part of that WISN we talk about it. What's in it for me? People get involved because they want to do something. We want to recognize them for that involvement.
And if you all go back to our old sessions where we talked about the risk and protective factors, one of the biggest things on the protective factors were recognizing people, recognizing young folks, recognizing and rewarding. So recognition is critical. And so that's really important just as much in volunteer management.
Tracy, can I just add one more aspect to it? This is that simple. That I really want folks to get the fact that you can have volunteers and not have volunteer management. Volunteer management here is really what Tracy's talking about, is that does not just simply happen. It happens because you put some intentionality behind the skills that Tracy just went through. And so it's really important. A lot of community organizations and coalitions kind of miss that fact, and you end up with the two and few doing all the work without having the ability to really bring on board and keep folks on board. Thanks.
And also, and thank you, Carlton. And one great example, I think, is someone, I think that Maritanise Nash said, she used to be a volunteer coordinator for the health department. Having that coordination is so critical. And that's what we're meaning by volunteer management. It focuses on the how. It focuses on what are some of the roles. It focuses on how are those values really conveyed? Is the organization or the coalition values conveyed to the volunteers? Because You don't want folks just following willy-nilly, if I can use that word today, and just going beyond without an understanding of why you're trying to accomplish something as a volunteer. You want them all moving forward and moving forward in a way that's really important. And then also we talked about, again, that really important of, do we have incentives? Do we have rewards to recognize? So when you're managing your volunteer group, you want to, as you move community organization to a real proper aspect, you really want to ask yourself the question, how are we managing? How are we recruiting? How are we moving it forward to make sure it's moving forward in a way that's beneficial and useful? But another piece beyond volunteer management is group facilitation. That's really important because we know that group facilitation really results in folks really being facilitated in a way that's done correctly. And sometimes you have to know your skill set. If you're not the facilitator, you have somebody on your team who's a good facilitator. But we know good facilitation really is you're doing it well. Why? Because folks really start owning it and really want to see the results that they're doing. We've seen a lot of examples worldwide of how community organization really took place, from social justice, from even COVID now, to all kind of health-related issues, to issues of just even giving folks wonderful birthdays if they can't do it during COVID. You've seen how folks own that process and how they get involved, and they really want to see the outcomes of the initiative take place. Okay. So let's look at a little bit about group facilitation and more of a specificity if we can. And I want you all to think about your role. Have any of you played that role in facilitation? And what has that been like? We know a good facilitator is a guide. We know that they bring folks together, they move people together, but also we understand as a good facilitator, you are not to be the know-all or the be-all to the process. So if you're organizing in group facilitation, you also know that that role of facilitation is really not trying to be the know-all, the be-all. You're not the seat of the wisdom or knowledge. You're trying to bring all the ideas and strategies together. The second one is about participation, and really looking at and monitoring how people participate. There really is that you view, as you facilitate, you're getting to see how people, if they're getting the aha moment, if they're enjoying the journey of the process, not just what got achieved, but are they really understanding the journey of why they're moving in this direction? So a good facilitation process looks at that. And then finally, a good facilitator, and I know for some people this is difficult, they have to stay neutral because you want to engage folks, you want to get them started, and you want to move them forward, and you want to make sure that they understand where they're trying to go so they can move forward and be the owner of that process, as I said earlier. So we know, in looking logistically at, facilitation, we know that ultimately it has to have some key components of how you facilitate. Just like volunteer management, facilitation takes a strategy or a process. When you're facilitating, you have to understand the climate and the environment. How does that look? What's the tone? What's the location? You can't really be meeting when there's another loud group, or if you're outside, it's hard to really manage that. What is the accommodation? Is it too many to facilitate? Then you look at the logistics and if you are in a room, what kind of arrangement do you use? I love to use U-shape or circles in my arrangement when I'm working with facilitating groups because I want everybody to notice that. You got ground rules, you got preparation. So ground rules is always setting that tone so folks know this is how we're going to take this process through. A facilitator really sets that, but they also check in with the group to make sure, how's it going? Are you feeling good about this process? And ultimately, you just don't talk about it, but they get to see the results on a newsprint or somewhere on a piece of paper on the wall so they can feel engaged in it. Preparation is critical. It engages participants in really how to get ready for the next step. And it really gets folks to really distribute the agenda ahead of time, because before you even do the facilitation, you want them to see that you're open and honest and transparent about the process. Ultimately, let's leave you with these tips, and that's important. You want to start and end on time. Always confirm the agenda. I like the second to the last bullet, and that's flexibility. Because at the end of the day, a good facilitator is flexible in the way they do things. And then finally, when we look at how do you manage and deal with conflict or resolution in this piece, you always agree on decision-making process at the very beginning. Don't get halfway through it. You use the ground rules that you had already said in the early part. And then I think what's really important that you always, because you can't get to everything, you always put things to the side, what we call parking lot issues. Maybe you have something on the wall, something taped up and say, we'll get to that because it'll take up too much of our time right now. But definitely take breaks and to discuss what's going on. These are just some simple but yet important facilitation, but it always has a process, as Carlton said. Facilitation always has a process. So I'll turn it over to Dave, and he'll be able to talk a little bit more about those next steps of really community organizing. Dave.
Thank you, Tracy, and welcome everybody. My name is Dave Shavel, calling in from Portland, Oregon. So thank you for letting me being part of your Southeast United States session today. And I love what Tracy's talking about, what Carlton has been talking about, and it's really about ownership. And so again, when we talk about volunteer management, when we talk about facilitation, it's about engaging both partners and community members in a way that they'll build ownership of it, because that's critical for the long-term success. Again, you think about the tobacco organization to get clean air laws in place and get smoking out of restaurants and indoor places. That didn't occur overnight. It took a long, sustained effort. So again, these skills are about building ownership. And the third skill is about cultivating leadership, so we can have leadership in the long term. And it's really about sustainability. There's a saying we like to use, people own what they create. Another way of looking at that is people own what they lead, or we can flip that and say people lead what they own. We want to build leadership among our partners, the stakeholders, the members of whatever effort we're involved with. Again, people are more likely to stay involved if they have a role, and more likely to have organizations stay involved if they have a leadership role in the effort. So again, this third skill is about cultivating leadership. And again, there are three ways to look at building leadership. The first is to identify who are those people, who are those organizations that can take that leadership role. So we can look at whoever we're involved with. Again, you all put up many good examples of organizational efforts, but who are the organizations? If there's a food bank, if there's neighborhood associations, if there's city government, there's law enforcement, if there's a school district, if there's the faith community, we want to identify who are those organizations, and then if not the head of the organization, who can they identify within the organization to be a leader and to be part of the effort to lead and facilitate and do the volunteer management and recruitment. The second aspect is how do we engage them? It's exactly what Tracy was talking about, engaging members of these organizations as leaders by having them doing the facilitation, providing training for them, opportunities for them to get involved in the efforts. And then the third one was my favorite when I was a coordinator for Coalition, is being able to, we as the host, to be able to leave the room and let people lead. So I used to try to manage it where I would have multiple committees meet on the same day, so I wouldn't be able to be at 3 meetings. I would make sure there were leaders, had the skills, they had the resources they needed in order to facilitate their meetings. They may not take it exactly where I wanted to, but they would own what they decided at those meetings. So it's about identifying who those partners are, identifying people who could become leaders, and then making sure that they have an opportunity to lead. And so the next one, the fourth skill, is about building those strategic alliances and collaborative agreements. That's a fancy way of saying creating a win-win situation for partners and their organizations. And it's really about sustainability, about building the efforts. So just an example, many of you may be drug-free communities or be working with community coalitions where we want, and a big piece of our assessment is getting school districts to do that youth survey. Now, under COVID, that's been a challenge, But when we have an agreement with the school in place to do those youth surveys, then again, whether it's under COVID or whether when we're back in school, they will see that and be able to do those surveys on an ongoing basis, because those surveys are so critical for the assessment piece of our planning. And so when we talk about creating the collaborative agreements, it's about doing, again, three things. It's about clarifying what are the benefits when we develop it, what are the benefits of doing the agreement. And there's two key pieces here. The first is building that ownership. Is when we have an agreement with organizations, we build their ownership and their involvement, and they see why they want to become involved in the organization, in the effort. And the second aspect of it is, again, holding people accountable, both us and our partners, in the work that we're saying that we're going to do. So if we can identify in the agreement what it is we're going to do, how we're going to do it, then they're more likely to follow through on it, and we can, again, work together toward that common goal of whatever the organization effort is. And those agreements, again, whether it's an MOU, this is where we get into our acronyms, a Memorandum of Understanding, MOA, Memorandum of Agreement, or if you're a drug-free community, they call them CIAs, Coalition Involvement Agreement. Whatever the agreement that you put in place is, again, there's an old saying, a contract's only as good as the paper it's written on. The agreement allows you to identify what are the benefits of the agreement between both parties, both organizations. What will they get out of it? That's that with them. What's in it for me? It holds them be able to identify what are their roles in it. What will each group do? It's not just what they will, if we're a coalition, it's not just what our partners will do for us, it's what the coalition will do for the partnership as well. And that's really setting the benchmarks and performance outcomes. What will each group and each organization do as they're part of it? And the third is the last point here, which we don't always think about. What's the mechanism for renewing and or canceling the agreement? Is meaning, let's make sure this is working for both parties. Are we meeting the benefits that we've identified? Are people meeting and doing the things that they said they would do? If it's working, let's renew it. If it's not working, let's talk about revising it or even canceling the agreement. The whole point is, let's put this in writing. So with that, we can take a breath here. And we've talked about 4 key skills, again, volunteer management, group facilitation, cultivating leadership, developing alliances. So if you think about it, and Kristen can put the poll up here, but thank you, Kristen. If you think about it, you've all put in the chat box different types of community organizing efforts. Every one of them involves these 4 skills in some way or another. So if you can go ahead and vote, I'm going to vote here. And submit your vote, and we'll see what the response is. But also, if you could put in the chat box while you're voting why you think which one of these is the most important. We're only letting you select one. We know the answer is all of the above. But which one's the most important for you? And if you could put in the chat box why you think it's important. Again, Jennifer saying volunteer management because, again, we need to use all these skills people bring to the table. If we don't have volunteers, we don't have a coalition. We don't have an organization. So what are some of the reasons why each of these are important? The within, that's in it, what's in it for me? That's part of all of these. We need to make sure that people are getting their benefits out of it.
You know, Dave, when they think about it, I want our audience and our folks to really understand that these key pieces are critical. But we want you to identify those ones that you feel that really works for you best in terms of what you do, in terms of seeing that key component as you act everyone. I know everyone says all the above, but if you had to choose one, and so thank you, Wendy Bates, for choosing one. She chose A, which was volunteer management. And that's important to know. So definitely want to continue to hear from you all as to one. If you had to choose one, what would that be? Thank you, Lindsay, for doing that. Cultivating leadership. See, key to sustaining. That's awesome to understand. We know they're all important, but to know which one really sticks out for you is really good to know.
And Brooks talking about group facilitation, setting the mood and the tone of our meeting. If I come to a meeting and someone's talking at me for 60 minutes, why would I want to go back to that meeting again? Am I engaged in that meeting? Did they prepare for the meeting? That's why those facilitator skills. And it looks like, again, there's still a mix of the different skills that people are taking. looking at the poll results here. And so the answer is really, it's all of these, and they're all important to collaborate them together. And Carlton made the point very early on. It's about being intentional of doing these things. Are we intentional with our volunteer management of how we facilitate, how we build leadership, and how we build those alliances?
And then lastly, Dave, I just want people to think about it. They mentioned all those different the community organizing things that they did in their communities. Think about who played that role with them with one of these 4 areas and those skills. Think about who those folks were, and then you have to think about how well they did. How well did they do volunteer management? How well did they do group facilitation? And so to use that as a tone to understand how to use that to be more effective in the future as we do prevention work.
And Melissa, I just noticed one of her points about the volunteer management is, again, we don't want to overwork our volunteers. So sometimes we talk about getting the right person to the right meeting at the right time. Let's make sure part of volunteer management is making sure that someone doesn't have to go to every meeting. What's the right meeting for them to be involved with where they can play an active role? There's some I hope everybody's able to read the chat box. There's some excellent ideas in there. Good. So it's enough to talk about the skills that we want to put in place. And please continue putting in the chat box. What we want to talk about now and spend the rest of our time here is applying. How do we apply these skills in the process of doing our work? And again, from a substance misuse prevention standpoint, we use the strategic prevention framework. We talked about this in sessions 1 and 2. And what we want to do is now provide an example and talk about how we can apply these skills as we walk through the strategic prevention framework. And so if you remember, Carlton did a quick review of these. There are, if you will, 7 elements of the strategic prevention framework. And so what we're going to do is provide an example where we walk through and talk about how we can apply these skills. And so again, as Tracy talked about, we want to apply them intentionally, which means identifying who we want to get involved, why we wanted them to do it, how we're going to get them involved, and what we're going to ask them to do as we walk through each element of the strategic prevention framework. And then to not only to keep it and to ground us, what we want to do is walk through this by looking at an example. And so we're going to walk through each of the 7 elements and apply the group empowerment skills through this example. So if you think about it, if we're a community and our problem is underage nicotine use and our root cause is availability, our local condition may be that youth are able to access vaping products and nicotine products from local gas stations and convenience stores. And so what we want to do, we want to create an initiative that change the local regulations and how we treat those examples where youth are getting access to the vaping product. So it may be we want to be increasing compliance checks. We want to be increasing the fines. We want to be decreasing where the vaping products are displayed and make them out of the reach, out of the eyesight of younger people. So we want to put together an initiative to change the local regulations around how vaping and nicotine products are available in convenience stores and gas stations. So that's the example we're going to use as we walk through this. And I'm going to ask Carlton and Tracy as we walk through this to provide their examples as well about how we can think about applying these skills to each of the elements of the strategic prevention framework around this one example. So we're going to jump into the strategic prevention framework by first looking at cultural competence. And we know that cultural competence is in the center of the strategic prevention framework, which means as we walk through each element, we need to do all these things. And this is basic to cultural competence, meeting people where they're at, making sure we understand what barriers or what challenges or what it will take to communicate and engage people. We need to build trust. And as we engage people, and we need to build strong leadership. So we can use those facilitation skills as we go through and do this community organizing around this. So if we take this to the next step and say, okay, in our example of this change that we want to put in place to change the regulations around the sale of e-cigarettes and nicotine products and vaping products, we can start to look at, I'm going to start with the second one, who needs to be involved in it and we need to be aware of. So if you think about it, we can look at who are the owners of these convenience stores and the gas stations? Who are the clerks that work at the stores that are the ones who are going to be doing the carding and keeping youth away from access to these products? Who are the customers that are going into these stores? Are they young? Who are other customers? Who are the neighbors that live in the areas? Who are the police that are, or whoever the enforcement body is? So who are the people that we need to involve? And then we can ask, what are the ways that we want to engage them? How can we facilitate them in a culturally competent way? So it's, again, we want to be thinking about, as we walk through assessment, planning, implementation, evaluation, and we're engaging these different groups, how are we going to engage them in a way that's meaningful and appropriate for them? And Tracy Carlton, anything to add to that as we think about cultural competence as a guiding feature to using our community engagement skills?
You know, I think from my point of view, Dave, is that when you were going through that, how do we get those local regulations to change in terms of dealing with this particular issue as it relates to prevention? You know, always definitely looking at how in my work in other communities around the country is that we've had to really do that assessment well and make sure that as we do the assessment about if we're going to change regulations for this, we got to assess our community really well and how they feel, where they are about this particular issue. And I found in some communities there's different groups of cultures who are not really up on the issue of some of these areas. And how do we bring them up? How do we assess their needs as it relates to this and bring them up to speed so they can understand and why it's important and how it may impact them? So when I look at the SPIF, I use that assessment as my beginning process to sort of understand the population that in which something like this would impact the folks in the community that it's being impacted for.
Exactly. And that's why we put, again, cultural competence in the center, and we start with it to say, let's start with not about us, without us is a way of looking at it. Let's start thinking about how we can appropriately engage people throughout this process. So when looking at the next element of the strategic prevention framework, we can look at the assessment. And if you think about it, we've already done, if you will, the needs assessment piece. We've identified the problem, the root cause, our local condition. But now we can take a look back and say, as we do our resource assessment, it's important to be thinking about it from a community organization perspective. What are the resources that we want to partner with in order to successfully implement the strategies we want to put in place? So here's where this is, again, what we've covered in the community assessment. We can look at a variety of resources, from human resources and then materials, services, facilities, et cetera, all the different resources. And this is a wonderful way to start engaging people and owning the process, because if they identify resources and they're involved in identifying and reaching out to resources, they're going to own those relationships. And a great tool to do this is through, again, community asset mapping or community mapping. There's various ways to do this. You can literally draw a map with, in COVID, where we're meeting virtually, you can put a map of your community on the screen and let people mark on the map what are the resources. Again, it will depend on what is the issue you're taking on, but you can use and involve people in identifying what are these resources, and then we can use those volunteer management skills, those facilitation skills, leadership skills that we've talked about in reaching out to the owners of the resources and say, hey, can you join us in this effort to address whatever issue that we're talking about? And so, again, to apply this to our example, if we look at changing the regulations around the sale of cigarettes and vaping products at convenience stores and gas stations, we can look at what are those resources that exist in the community. And it may be a neighborhood watch association of the neighborhoods that are living around. What resources? They have the organizing, be able to get residents involved. We can look at the Chamber of Commerce as an example. They have an interest. When we look at these resources and we want to reach out to them, we want to look at it in terms of what are their interests in doing this. The Chamber of Commerce, they may have these convenience stores, these gas stations as their members. They need to provide services. So can we match them up with someone who provides responsible beverage server training or tips training and get them involved with that? Other resources could be if there's a retailers association, law enforcement, they have certain resources around compliance checks. Who's doing retailer education? If there's not these resources, can our organization bring that group in? So it's really starting to think about who has control over these resources, and then we use our leadership skills and our skills around strategic alliances to say, how can you work with us in a way that benefits you as well as us around our particular topic? So again, the resource assessment is a great way to think about how and who we're going to be engaging in this effort.
And David, many places I've seen where in different communities, where as it gets to this point, we've seen a lot of individuals really work closely with educating these resources about why this change needs to take place. Sometimes just holding individual group educational sessions as to why we see this as an important piece and how they can play a role in impacting this regulation, because it still could be a win-win. We still don't want it to keep it from happening, but this is why we need to make a change on this issue and why it's important, because it impacts our certain population or our future population. So educating them and educating them to be that is really critical. And I also added, I've seen a lot of folks use their local attorney general offices or state attorney's offices to really be a part of this as well.
And thank you. And this goes back to what Carlton talked about at the very beginning, his mental set of the team. We don't have to do this alone. We can bring different members in. So if I was a quarterback for my team, I might want to bring the greatest tight end of all time onto my team to help with the effort. So that's an example of looking at a resource and bringing them on board that we may need.
David, and I just wanted to add to what Tracy said and totally ignore the little dig that you just did on my team. I appreciate that. But I want to encourage folks to think about non-traditional resources as well. So, for example, the faith sector and members of your faith community. There's an extraordinary coalition in Hunterdon, New Jersey, that has this incredible effort called One Voice, in which the faith sector really takes a leadership role in cooperating and collaborating with their local prosecutor for the county. And that relationship of the county prosecutor's office and the faith sector really produces a wonderful, effective ability to communicate, advocate, and promote understanding and awareness of challenges that communities often are neglecting.
I'm glad you mentioned that, Carlton, because there's also an example of the faith community on the west side of Chicago with West Garfield Park stakeholders and Fathers Who Care, who are a group of ministers who are doing the same thing as it relates to different issues around prevention. So that's very, very important. And that's a non-traditional group that we sometimes overlook.
And what you're all talking about is, it's a term from Collective Impact, but it's called mutually reinforcing strategies. And really what we're talking about here, let's identify, we don't have to recreate the wheel, who those partners are in our community that are already doing this, and then frame the issue in light that addresses how they can contribute to this effort as well. And again, there's a comment about SIPS is promoting getting the faith community involved. So there are ways, again, it's about what Carlton talked about, being intentional about reaching out to resources in the community, which is very similar to, again, when we talk about building the capacity. And again, those resources are part of our capacity. And basically thinking about the skills we talked about, capacity is about engaging our partners in a way that we can create through strategic alliances this win-win situation. And so when we think about building capacity in our community, we've talked about this as who are the different organizations, individuals, and leaders that we can engage in this effort to, again, build our capacity. Again, when we build their leadership, we build their ownership of it. We've talked about governmental and organizational leaders. And again, we've talked about influential, informal leaders. And now, Carlton, and I know in your training, when you were training and organizing in Philadelphia, you had a Ma, and I'm blanking on her last name, that was basically, she lived in one of the street corners. What was her name? You remember her training, Ma Pritchard or something like that?
Miss Burdell. And thank you for bringing her up and reminding me. But Miss Burdell really taught me more about this work than any training or issue or anything. Like, she was the block captain. That's the way in Philadelphia neighborhoods organize themselves through the use of these extraordinary individuals who, in many cases, were not formally educated, but my goodness, you didn't dare do a doggone thing in that community without making sure that Miss Burdell and those like her were a part of the conversation. But she really broke down a lot of walls and barriers to help enable community change efforts that we were working on behalf of, and that would not have happened without the likes of Miss Burdell.
And those are those informal leaders. And when we don't want to leave out youth, they may not have positions in the community. They may not work for specific organizations, but they are clearly leaders in their communities. And within the sub-communities of youth, the different aspects of youth, can we get them involved? How do we reach out? And again, it's about being intentional about reaching out to these different stakeholders, the formal and informal leaders in our community.
There's a question about how often do we feel a coalition needs assessment or community assessment to be updated and reviewed? Thank you, Allison, for that question. How often do you feel a coalition needs assessment or community assessment be updated and reviewed?
Go ahead, Dave.
Yeah, well, again, I'll say there's different levels to that answer. One way of looking at it is how often you do the student survey. Again, that's where you get new data. So some coalitions do it annually, some coalitions do it every other year, but they use that as an opportunity to say, let's revisit our plans that we've got in place. That's at the organizational, at the community level. I would also say we can do this around specific initiatives. We don't want to wait every 1 year or 2 years if we're taking on, for example, the local regulations. Let's do our assessment more frequently around specific issues, specific local conditions, to see, are we making a change to those conditions in our community?
That's exactly what I was going to say. That's exactly what I was going to say, Dave. So you seem like I've been knowing you for a while. Yes, I've been hanging around with you these last few minutes. That's exactly what I was going to say, so thank you.
We went to the same school of community organizing. So if you think about it, again, in our example here, building capacity, it's what we've talked about all the way through. It's who are we engaging and how are we going to build alliances with them for the long term. And one way of looking at that is by saying we've talked about the chamber, law enforcement, retailers, it may be a parent group. One way to look at building those alliances is to frame the issue in a way that's consistent with what their organizational mission and vision are. So again, the chamber, I've talked about this, but the chamber, their mission is to support their members and provide for a strong business environment in the community. So they're concerned about making sure that these convenience stores and gas stations stay open, but stay open and meeting their legal requirements. Law enforcement, they want to maintain their laws, but they want to get community to support them so we can support law enforcement in that. The retailers themselves, they want to make money, but they also want to stay in business. So we can frame each of these. The neighborhood groups, they want safety in their neighborhoods. So in terms of building capacity around this particular issue, is framing it in a way that they'll see the long-term benefit of why they want to stay involved in this particular effort. Which then allows us to move on to the next, which is planning, and I'm going to turn this over to Carlton.
Thanks, Dave. And Kristen, if you wouldn't mind, if you can switch over the ability to manage the slides. Thanks so much. So I want to pause for just a moment here. We've given and provided a good bit of information. There was just a little bit more that we want to get through. And in fact, when designing this training, folks, I want folks to recognize that as we are going through all of this information, we put in things that were important and essential, particularly for those of you who may be seeking prevention specialist certification. And all of these concepts and ideas are important and relevant for those of you who are pursuing that process. And so I wanted to take a moment and ask you all to please pay attention to some of the questions we're posing. Even though we are applying it to a specific example, those questions are really the kind of questions that you're going to want to ask yourself in your specific prevention programming and your community change efforts as well. And so with that, I want to go into the next 4 areas that are important elements of how we do and apply community organization to the concepts of the strategic prevention framework and practical applications. Most good preachers and teachers always narrow things down to three critical bullet points. If you have more than 3, man, you got to go back to class. You got to condense them down to 3. And so for each one of these, we want to give you the 3 big ideas here. As Dave mentioned, when we're talking about planning, the role in which community planning plays in community organization is really around building ownership within the community, right? And I have come into contact with far too many coalitions and prevention providers who have a hard time. They have a program that they're trying to execute and implement, but they don't have the folks engaged in their community and their population to really help ensure its effectiveness and success in the way that they had envisioned. And that's really because there are the intangibles that are really important among trying to make sure that your plans are moving forward. And so what is it that you need to pay attention to? You need to pay attention to how are you using those resources within that community? Have you conducted a resource assessment so that you can understand where those formal and informal resources are, so that you might be able to see what's necessary and where your gaps are to be able to engage communities in the broader institution. Engaging those key stakeholders, as Dave talked about earlier, is vitally important. Understanding, again, the who and the how we're going to be able to engage each of them in those in our community planning and prevention efforts. And ensuring that we're doing so by including all of the various diverse voices within our community context is so important to understand that before you're able to move forward with anything, you really need to pay attention to whose voice aren't we hearing from that will be important. That may be someone that might come to obstruct what it is that we're trying to do. Unintentionally, you might be able to set those things off because you didn't first take the time to identify, did we make sure that we have all the diverse voices in our conversation? This is all the whole concept that folks own what they create, right? If you provide space and opportunity for folks to be a part and contribute to the development of the plan, they're going to take ownership in that. And so creating the opportunities by which you're able to do that is vitally important in terms of planning. Here within our example, we want to ask a couple of questions. Are you engaging those key stakeholders, and how are you doing so? And how are they involved in the decision making? Were you thoughtful enough to make sure that you created the space and the opportunity and gave them the skills that are necessary, provided the skills that are necessary for them to participate in a decision-making process? That's what we did with Ms. Burdell, right? That's what we attempted to do with Ms. Burdell. It's not that we gave her anything, but we did create space that made sure that she bought into the conversation that we were hoping the community would be able to have. All right. So please, you want to think about this. I would suggest that if we're looking at changing the local regulations around e-cigarettes and vaping products, one of the folks that we want to engage are young people. They have a particular investment and engagement and involvement with this particular product, and may provide some information and resource with respect to the culture that's associated with the use of those products that we may not be aware of because, quite frankly, I'm old and I don't understand what the value is as some young people might. So I think that that's part of where we would want to make sure that we're paying attention. The second idea and the second concept here is then in execution, right? That is the implementation of those plans and strategies. And again, here are three key ideas that we want to make sure that you're, as prevention professionals, attending to. We've already talked about much of this a great length throughout this training, but here we're applying those tools and those ideas and those concepts that Tracy and Dave spoke to earlier. Here's the reason why we want to be intentional about how we're working with program staff and volunteers and making and ensuring that they have the capacity built within them that might be able to prepare successfully for the implementation of our efforts. That we are indeed ensuring that we are not only transmitting information to the community, but we have a mechanism by which we are able to hear back from the community in reference to the implementation of whatever program, practice, or change effort that we are associated with. Have we created what we are referring to as that feedback loop so that we are able to make sure that we're in tune with the community's understanding of that? And are we doing things in such a way that we are increasing the awareness, the attention, the understanding of this issue, of this challenge, of our change efforts with the communities that we are serving? And there's the old adage, if a tree falls in the forest, but no one's around to hear it, does it really make a sound? Well, I apply that to our prevention efforts. If we do all the work of identifying, then selecting, and making sure that we've created the right program with the right fit for the right issues and challenges of our local community, but we don't engage the broader community in the understanding of that process and also the implementation and the importance of that program and that practice so that they're even aware of it, does it really have the impact that we want it to have? So that's all associated with implementation. Implementation is very, very key with respect to that. Dave or Tracy, any additional comments that you want to have towards implementation?
What I like about it,
Go ahead.
real quickly, can you hear me?
Yes.
Okay, great. That was an awesome analogy. And what I like about it, Carlton, is the piece around that relates to have we, in fact, looked at the first part in training. If we're going to do any good in community organizing, any good volunteer management, we got to provide that appropriate training to our volunteers so they know how to really, really make it happen, and so they can be engaged and be informed and be knowledgeable to move the values of the coalition or the organization of this initiative forward in an effective way. And then the last piece is just really about that whole idea of raising that having that two-way feedback loop I've seen has been the disconnect in a lot of community organizing strategies, particularly around implementation, because we bring the organization and styles to the community, but we don't feed it back to Ma as a neighborhood block person, and we don't tell her how what we found, what we're doing, how we're doing it, how do you feel about it, should we do something different? We don't do enough of that, and I think that's probably a disconnect that happens a lot in this part.
Without question, Dave and I, we often refer to that as the Star Trek phenomena. It's kind of like when you beam in to the community because you're from the government and you're trying to help, and you're there for whatever length of time, and then you beam back out, and you never take the opportunity of making sure that the community is engaged in that process. That can often do more harm than good in our communities. Dave, were you going to add anything?
Well, I was just going to say that public awareness, it's also the concept of visible enforcement, is when people know a law is being enforced, then they're less likely. And a good example of that is around compliance checks. There were some communities where what happened was once they did the first compliance checks, the retailers had a network and they all called each other and they said they're doing compliance checks, so they all were carding. Well, that's good. That means instead of doing 30 compliance checks, we really only needed to do one at a time, and the network would kick in. So that visible enforcement is part of that public awareness.
Absolutely. And Aaron, hey, Aaron, has a great comment with respect to understanding that some of the questions that they use on their survey deal with youth perception. They do that intentionally, like how do they feel it is that you get in trouble or be reprimanded for possession or for substance misuse or tobacco misuse. All of that is so that we have a greater understanding of the community's involvement and engagement in this. Excuse me, folks, just trying to get this to work. There you go. Again, key questions for you to ask, really all around the who and the how with respect to this. Who is involved? And how are you facilitating the implementation in a way that participants have that ownership? We've talked at length about that. I think we've conveyed that point. Which brings us then to evaluation, right? These are all the steps of the strategic prevention framework. You have all heard about the SPF. What we're talking about is how you practically make that SPF concept real. And we do that through the course of community organization. We've been through a concept and a practice called participatory evaluation, right? And that gets into a lot of things, but for our purposes, there are three aspects of it that we think are vitally important for us to consider. One, are we providing an opportunity for participants to define those evaluation questions? This is partially where Aaron was going, making sure that we have questions that are sensitive and appropriate and proximate enough for the populations that we're intending to serve. Are we inclusive of those participants in our data collection methods? Have we engaged those participants as potential collectors of those data, right? Here's the whole point of it. I've often asked the question, have you ever had your picture taken by a photographer and then looked at the picture and said, that doesn't look like me, right? And you have that response. Well, I would share that many of our communities have the same kind of visceral response when we come and we share that we're doing these things because we took a picture, but we never engaged them in that process. Right? And so many of them have the reaction, well, that's not us. You didn't ask me. I didn't participate in anything. Right? And so this is why it's so vitally important and why we thirdly must engage participants in the analyzing of those information and the opportunity to share those results. Again, this is all about creating and generating ownership throughout the entirety of this process. And we need to do a better job of that in terms of our evaluation efforts. For our communities. Yeah, go ahead, Dave.
Look at the skills we talked about. This goes back to those leadership and those strategic alliance skills. Can we put the evaluation into our memorandum of understanding? That's all part of, again, people owning the process in a way that they see the value to their organization as well.
And an extraordinary way of making that really, really practical. A very small thing like that helps create a really wonderful result. I'm sorry, Tracy, go right ahead.
I was just going to say real quickly that even providing this to our volunteers and how we manage it and how we retain them, we keep them in the loop and tell them how well our evaluation is going, what we're doing, what should we be doing differently, how should we be doing more, who are we missing. So the evaluation provides, by keeping our volunteer management process going, this evaluation is that participatory, like you talked about, for volunteers as much as it is for community. It's a way to keep that that community organizing process going because of that.
Absolutely. The most important aspect of this is this is the way in which we tell our story, that any community coalition, that any prevention provider, that any prevention leader is able to tell a story. It is the most important aspect of the work that we do in order to make sure that there is investment still involved with the kind of change efforts that we are about. It's a practical thing. It's one of the most important elements of community organization. Which then brings us to why we need to do this and consider this. This is all about making sure that we're able to stay invested in this change effort for the long haul. And how we do that is that we plan for long-term involvement and engagement. We make sure that we are able to adapt our efforts so that the community can participate in this process called the Strategic Prevention Framework, right? So that's adapting to the needs and the makeup and the cultural context of our community so that we might be able to engage them fully and build the ownership in which. That's what leads to sustainability. each of those aspects being intentionally pursued and understood from the start of our campaign, from the start of our prevention efforts. I'm kind of going through this quickly because we need to be attentive to some of the timing, and I want to be fair and considerate of everyone here. There's a lot deeper conversation that we can have with respect to this. We may be getting to some of this during our master class on next week, but I will share with you that please put your questions in the chat. We're going to provide some opportunity to have do some thinking around the questions, but I wanted to make sure that we talk through the entirety of the strategic prevention framework, that we took the strategic prevention framework, a concept that I know you all are listening to and hearing about and being required to implement, and understand in a very practical way how to apply that to some of the needs for your prevention efforts. And so we've walked through the SPF. In terms of our example here, again, key questions: how are partners engaged on the ongoing enforcement of those local regulations? This is something that Dave mentioned earlier. It's oftentimes one of the things that are overlooked, and who's going to be responsible for maintaining that over the course of the long term? These are questions that we think of and compose up front, so that we can make sure that we're mindful and planful with respect to them during our implementation of our strategic planning.
You know, Carlton, what I want to do is quickly just add to folks, as many of you are new in the prevention field or learning the prevention work, and we do this about community organizing piece because it's not about me, it's about we. You need the we in this process to really be effective in your communities. And so we want you all to understand that it's not about you just doing the work and then having to own it, but it's about building the community organizing skills so folks can really get it and it becomes a we factor and not a me factor.
Absolutely. So, folks, we want to provide just an opportunity. We went through a lot of information, and if there are questions, please put those questions in the chat right now. We'll take a few moments to consider that. As folks are putting those questions in the chat box, Kristen, if you can look out for them and let us know when we have some. I'm going to go first to Dave. We've talked about prevention fundamentals in the first training. We talked about specifically assessment, planning, and evaluation in the second training. And we've now kind of talked through all of that in terms of community organization. Are there any key ideas that you think are relevant as sort of a tie throughout the entire thing, as this is kind of our last training with these folks through this series? What thoughts might you have that you want to share with folks? And I'm going to ask you the same thing, Tracy.
I think it goes back to something we have mentioned in every one of our trainings is people own what they decide, people own what they create, people own what they lead. It's all about, it's been a common thread, how we're engaging people and doing this effort in a way that they see the benefits to the community as well as the benefits to them and their organizations.
Thank you so much. Tracy, instead of that question, I want to pose one that is offered by Kristen Olson to you, if you wouldn't mind. I don't want to put you on the spot, but I want to give us all the opportunity to think about it. Given COVID restrictions, what are some suggestions on reaching out and engaging key stakeholders?
I think there's several ways that I've found to be effective that we've done in several communities. One is, as you reach out to key stakeholders, the idea of having an email and then setting up a phone call. Having an email, follow up with another email, and then offer to talk to them by phone. I think engaging other key stakeholders, what I mean by the key pastor in the community, the key community leader in the community. Even in some aspect with COVID, I've seen some communities where they have met individually using the key COVID requirements of space and mask and washing hands of having face-to-face. But most of the time what I've seen them do is emailing them and then following up with the conversation by phone and asking them about ways that they can still be involved in spite of COVID, how they can really have some efforts and have some examples to give them before you talk to them about it.
Dave, I'm going to pose the same question to you. I know we've done a couple of trainings together on COVID and the application of the SPIF. Any other key thoughts that you might offer, and then I'm going to move on to this next piece. Go ahead.
It's engaging. It's that decision making. We still can reach out to people and get their involvement in decision making. It doesn't have to be through a Zoom meeting. If they can't make the meeting, get their in their viewpoints on any given decision ahead of time. So you can say, hey, I talked to the chief of police. I talked to so-and-so, and here's what they think about it. So again, if we can involve people in decision making in a variety of ways, they don't have to physically be there to be part of that decision-making process.
Fantastic. Folks, listen, you guys rock. It has been an extraordinary conversation with you all over the course of these last few trainings. We're looking forward to the conversation with the masterclass on next week. For those of you who are able to attend. For those of you who are able to attend that, please, if you haven't seen or been a part of the 3 trainings, please go back and look at the videos for the 3 trainings in preparation for that training as well. Kristen will give you that information. You can see on the screen the link for the evaluation for this piece. And with that, Kristen, I want to say thank you to the Southeast Prevention Technology Transfer Center for thinking about this and making sure that this was priority. I want to say thank you to my team, Dave and Tracy. You all are extraordinary. Folks, thank you to each and every one of you for all the great work that you all do. And with that, Kristen, I'm going to turn it over to you.
Okay, well, thank you so much. I've seen some really positive comments in the chat, and I really am glad that you've appreciated this webinar, and I've really enjoyed working with these 3 great presenters. You guys they're a lot of fun, and you provide really great information. As Carlton said, there is an evaluation. This is the link to the evaluation, and from this link, you're either automatically going to be sent or you can feed it along to the PDF of the certificate of attendance. So make sure you do that. If you have any problems, everyone's got my contact information. You can ask me and I will get it to you. But I think that's it. There's a parting thought here from the team. So go out and make some really good trouble now that you learned about community organization. Make sure you're engaging diverse voices within your community. And with that, I'm just going to leave it here. And I will just say, everyone wear your masks, keep your distance, and stay safe. And have a great week.